we see the staff responding to the film. We've already done some work with the patients, so we know the patients have confidence to actually speak to the staff about some of their experiences. And they actually are very supportive in the way in which the patients are very supportive in the way in which they respond to the staff. That's something that I found quite surprising about this as an approach. On paper, it might feel that it's a bit confrontational, but the reality is that it's very, very much about bringing about understanding between people who are coming at things from a different perspective.
I think the video was important because people could actually see what you felt about things rather than read about it. You know, you can write loads of sort of points and things, but actually seeing some person saying something about it was much more important, had much more impact.
Flavor of the good, but certainly it is very eye-opening and humbling experience to listen to the patients talking about how they felt, what their experience was, whether in the clinic or when they're having investigations or then on the ward. And we certainly learned a lot from that.
That dialogue was important. I think if they'd just asked for our opinion, it wouldn't have worked as well. We needed the eyeballing of each other to make it work, and to have the doctors involved. I mean, for the consultants to take time out to come and the senior nurses from outpatients to come. I mean, it was a very big group and, you know, wide group. So it was, I thought it was very good.
To get the doctors and the patients to sit at the table and to discuss things was a good idea. If the patients had been sat on one table and the doctors on another table, I don't think it would have worked. So to get them to sort of, you know, mix, and it's less confrontational anyway, because, you know, you're gonna, you know, you're just gonna discuss issues regardless of what you think about it. So I think it worked really well.
There were people that found it a challenge to listen to the things that weren't right and found it quite difficult to hear. But actually, unless we hear that, we're never going to move forward and resolve these issues. So I thought it was fabulous, absolutely fabulous.
Deep down, they know we care. And there are lots of patients say, I didn't really want to say that to hurt your feeling. And which is lovely. But again, we will never learn unless they start. I think it was an encouraging experience for them. We made them feel, yes, do complain. Do say that we got it wrong, because without you saying that, we'll never get it right.